Hi, my name is Lana, and today I'm going to share with you some simple natural remedies. Today I'm going to explain to you a hot foot bath, which is another form of hydrotherapy. And again, what is hydrotherapy? Simply, it's the form of using water as a therapy or water for healing. So with a hot foot bath, you want to make sure that you gather all your things beforehand. So you're going to need a bucket that's big enough to put their feet in. You can use a bucket like this. As long as it's above their ankles, then that's okay. But I really like to use a bigger bucket. And maybe you don't have one big enough for their feet. Maybe you need one pail for each foot. But you want to be able to have their feet in the bucket and have the water up above, even to their calf if you can. You need a basin full of cold ice water and a face cloth. You're going to need some sheets, one for draping the chair to keep drafts away and one for draping the person you're working with. You're also going to need some towels to dry them off after, and you're going to need a kettle. Your buckets will be full of hot water, but you're also going to need to continually make sure that the water temperature is still up. So if you're in a room where there's no taps, make sure you have a kettle. If you're in the bathroom, the hot water tap is usually hot enough, but if not, have yourself a kettle nearby or some already boiled water. Also, another important thing is to always have a water glass and a straw to make sure that you're keeping the person hydrated. Because when they start to sweat, they may start to feel uncomfortable. So you want to have some room temperature water for them, okay? Again, what is hydrotherapy? Hydrotherapy is the use of water in therapy. So when you apply different temperatures of water, hot or cold, it has a different effect. Also, with the duration of how you apply it. So if you apply cold for a short burst, it's stimulating. If you apply cold for a long period, then it's it decreases the stimulation of the body and it slows the body down. And with hot, like moderate short-term exposure to heat is also stimulating again, but long-term exposure to heat causes a very sedative, relaxing effect. Hydrotherapy is used to facilitate circulation in the blood and bring oxygen to the area. Lots of times when you have an injury, blood tends to pool or congest, or if you're not feeling well, blood can congest in your stomach, or with dysmenorrhea, it causes a congested pooling of the blood. So you want to cause that blood to move around, get some circulation, get some oxygen to the area, and sometimes even with the foot bath, it's to pull the blood to the feet and circulate it around instead of allowing it to pool. Also, hydrotherapy is soothing to the nerves, and it also can relieve pain and swelling. So there's many different uses for hydrotherapy, and there's many different forms. With diabetics, I just want to caution you when you're doing hydrotherapy on diabetics, especially with the extremities. A lot of insulin-dependent diabetics have an arterial disease which reduces the flow of blood in a certain area. And when you bring heat to that area, it causes complications. It can actually break down cells and lose oxygen from that area. So that's why with diabetics, it's a contraindication to do a foot bath. Also, they have a hard time being sensitive to heat. They may not recognize when their feet are getting too hot. So be very cautious. Some diabetics may not have this arterial disease and they may be able to feel the stimulation of heat. So in that case, be cautious still. Make sure you're talking to the person you're working with. Find out if they have these problems. Don't do it at all if you're concerned, and be very cautious if you decide to go ahead with the treatment. Now with the hot foot bath, some of the indications or different reasons you may want to apply it is congestive headache, chest congestion, maybe pneumonia, bronchitis, something like that. Preparation for other treatments just to warm the person. You can even stop a nosebleed. Dysmenorrhea, which is a very painful menstrual cycle, cramping, headaches. Even a common cold, to kick out a common cold, a hot foot bath is great for that. There's many things you would use a hot foot bath for. Reasons you wouldn't want to do a hot foot bath, or the contraindications for, is a circulatory disturbance or lack of stimulation or sensation, in their limbs. So what I discussed with you on diabetes. Also, if they have very large varicose veins, or if they have some form of vascular disease, then you wouldn't want to do this treatment. Infants, elderly, debilitated people is probably something that you wouldn't want to use. Those are some of the contraindications that are given for the hot foot bath. Now I want to talk to you a little bit about when you're in the treatment room. Always be sure when you're in the treatment room to be calm and courteous, patient and kind with the people that you are working with. Help them to feel comfortable. Don't tell them, oh, just take the cold. Prepare them for the cold. Talk to them about, I'm going to apply a cold cloth to your head now. I will and apply it slowly so that you're not just abruptly putting the cloth to their head and giving them a shock. Before you even start the treatment, it's important to always pray with them. I usually ask them if I can pray, and they always really appreciate it. It's very rare that anyone will say, no, thank you, they don't want prayer. Make sure you have a positive attitude. Don't talk about negative things. Don't talk about their disease and cause them to feel discouraged. Be encouraging and cheerful. Keep the person feeling comfortable and hopeful. Also want to make sure that you never chill the person. Always keep the room warm. Make sure there's no drafts. Make sure that after the treatment, you've made sure their skin is dry so that they can have a comfortable reaction time. If they're sweating and you use the same sheets that you used when they were sweating and they're damp already and you lay them down to rest, they're going to get chilled. So make sure you get a fresh sheet. Make sure you've dried them. You get a fresh sheet. Lay them for their reaction time. Reaction time is very important. Reaction time increases those white cells, and those white cells are our fighter cells. So you want to make sure they get at least a half an hour to an hour rest after a treatment. Always finish with cold. Always make sure that you close up the pores and you're strengthening actually the skin tissues with the hot and cold. So make sure you close the treatment with a cold pour. So this is just to give you an overview of the hot foot bath. So again, the things you need are sitting right here. And again, reminding you again, keep water by, ask them if they need some water. Now I'd like to show you how to do it. So now let's go, and I'm going to give you a demonstration on the hot foot bath. Hi, and welcome to our demonstration today for a hot foot bath. As you can see, I already have some things set up, and I just wanted to show you that when you're giving hot foot bath, it is important to actually drape your chair first. So I just want to explain to you why it's important. Because when you're giving a hot foot bath, you don't want any drafts. So when you drape the chair first, then you're preventing drafts from coming underneath the legs. So you see I have the front all closed off. So now I'm going to have my person come and sit down here so that I can show you the rest of the treatment. Hi. All right, so when you do a foot bath, you can use a smaller basin like this size, as long as you have at least their ankles covered. But I really like to have a deeper basin, so that's why I have this blue one here. But use what you have. So you can use this type, you can use a pail, you could use 2 pails if you don't have one pail big enough for their feet. Once you have the person who you're going to be treating sitting in the chair, then you take the bucket and just have them back their feet off a little bit. Make sure you have the bucket so it's at a comfortable distance for them. So once you have the person sitting down and you want to take their feet and guide them into the water, because you want to make sure that it doesn't shock them. So you want to slowly get their feet used to the temperature of the water and guiding them in. How does the water feel? Good. Okay, so I'm going to just lower her feet in slowly. Now we need to drape her and the bucket, because what we're working at is we're trying to work up a temperature to get her warm, to get her to a sweat. So now we want to drape the person and the chair. So we're going to make sure you have a big enough sheet. I'm going to bring it around. You don't want to get it in the bucket. Sometimes what I like to do is tuck it under the bucket so it holds tight here a little bit, because then it's not so prone to go into the water. And these little clips are handy for this. So I'm just going to clip. Is that too tight? No. Okay. You want to make sure she doesn't have air drafts coming in anywhere. Do you feel any air coming in? No. Okay. So those clips are really handy if you don't have clips. You can use pins like these. You can use whatever you have. You can use hair clips. All right. So I think we have everything nicely draped, tucking in all the edges, making sure there's no air drafts coming in. And there we go. So now, as we have her sitting with her feet in the warm water, she's going to start to warm up, and the water is going to start to cool. So you have to have a kettle nearby to make sure that you're able to continue to warm the water. And when you do this, it's very important that you protect the person. So you know what's coming. You can see where your hand is. When you go in to warm the water, we're just going to lift the sheet a bit. You don't want to get too much air. Please move your feet to the side of the bucket. I'm going to come in with some hot water now. You always make sure you're talking to the person you're working with, and you're talking relaxed, and you're not doing anything anxious to make them nervous. So then you're going to just wave your hand in the water while you pour the water in, making sure that it's not coming near them at too hot a temperature. How's that feeling? Good. Okay. And then again, you're going to close everything off. No drafts. And this treatment is a really good treatment for if you have a headache. Sometimes you can do just the feet. You can do the hands and the feet if you have a headache. Making sure you keep the person warm. Putting a cold cloth on their head as well. Once they start to get their heat up, then they're going to feel like perspiring. So you want to make sure you have on hand a bowl with some ice water in it, nice and cool. And then as they warm up, when they have a headache, it feels really good as they start to warm up. Okay, I'm going to bring the cold now. And you just want to gently, you just don't plop it on their head and then shock them. You just gently bring it in. How does that feel? Good. And then you want to keep this cloth. Sometimes you can even use a hand towel. Depending on how much the person perspires. Some people perspire more than others. So you can actually take a hand towel, and it makes it a little bigger, and you can have it just resting there. Sorry about that. Smooth the tag. And sometimes they may want you to just take and cool their neck a little bit. Okay? So when you're doing this treatment for a headache, you want to keep the ice on their head and keep their feet in that hot water, bringing up the temperature, occasionally checking, making sure that their breathing is fine, making sure that they're not getting anxious or anything. Sometimes when people get warm, some people can get anxious, so you don't want to assist that by you having fretful movements or jerkiness, so you want to be slow and comforting. Another treatment, another condition that this treatment is really good for is dysmenorrhea, which is a painful menstrual cycle. Some people can get very nauseous, they can get a lot of abdominal cramping and headache, and even to the point of throwing up. I personally experienced a person with severe dysmenorrhea, and I didn't know what was wrong with them because they couldn't even speak to me. But then by the time I found out what was wrong, she'd already vomited, but I took and gave her a foot bath, and it brought her instant relief. She was able to speak, and she laid calmly. Sorry about that. So also, you can do this treatment in a bed. If a person can't get off the bed, they can be laying in the bed. You just make sure you're protecting the bed again, and you place your, probably a smaller one though, like this one that I showed you earlier. You would place this size bucket on the bed with them and put their feet in there, and then you can do a successful treatment from the bed if they're not able to get out of the chair or out of the bed. How are your feet feeling?
Very good.
Okay. Just going to check that one more time. So if you have to, you again would just roll back your sheet, ask them to move their feet, and then again, you protect them, always protect them from the heat going straight onto their feet. So this treatment can go for 20 to 30 minutes. You're trying to get a reaction to where if they have a headache, you're drawing the congestion from the head down to the feet. If they have pain in their abdomen, you're drawing that congestion from there down to the feet. You always make sure you come back, you check the cloth on the head. As it warms up, you get a new one. So if a person has a cold coming on, or they're just not having good circulation, there's so many indications for doing this treatment, and I've shared those with you in our presentation on what is hydrotherapy. So now we're going to close this treatment off. So after the 20 minutes, after the 20 or 30 minutes, however long you've kept them in the foot bath, then you come around. You want to remove their feet. You're going to take their feet again up in your hand so that they're comfortable. So, and then you take your cold, ice cold water, and we're going to do a cold pour on where the feet were in the bucket. She's got some ice cubes on her toes. Just take those off. Now, when you do a full treatment, you will see their legs and feet will be pink. That's okay. That's what you want to see. You want to then take their feet and you want to make sure that you dry them off nicely, their legs. And when you're drying their feet, make sure that as you're drying their feet, you take each foot and make sure you get in between their toes. Let them feel nice and relaxed, and that they can feel that you care about them. Okay, there you go. So once you've finished the treatment, the person needs to have what's called a reaction time. And this reaction time also helps to boost the immune system. So you want them to rest for a half an hour at least. I hesitate to say that again because you really want them to rest for an hour at least afterwards. And then it actually boosts the immune system immensely. If you just did the treatment without the reaction time, you don't get quite the benefits you do. So encourage the person to have a rest, to stay warm, go to their bed, lie down. If they're perspiring too much, you can do a cool mitten friction, and you can just quickly rub their body to dry, and then dry it off with a towel to cool them down a little bit. Or they can go and have a tepid shower, neutral shower, and just rinse off the sweat. But it's best to do that after they've had their reaction time. I like to see them even sweat a little bit because it's getting some of the toxins out. I just want to thank you for joining us with this hot foot bath demonstration. Make sure you watch the beginning of the video, which explains the indications, which means what reasons you would want to do this treatment, or the contraindications, because sometimes there's certain conditions where you may not want to perform this type of treatment. So make sure you watch the first part. I explain those things. And also, if you have somebody who's very sensitive to heat, diabetics sometimes are very sensitive to heat. So make sure that you're talking to them the whole time. Your water temperature does not want to be as hot, and you really exercise caution with elderly and people who have diabetes, things like that. So again, thank you, and we'll see you back with another demonstration.